Thank you, Amir. Good afternoon, everyone. Thank you for joining this webinar titled, How Will We Know Whether We Are Making a Difference? Evaluating Knowledge Translation. As Amir has mentioned, my name is Bey-Marrie Schmidt, and I'm a researcher based at Cochrane South Africa at the South African Medical Research Council. I'm just checking to see whether you can see slide 2. Okay. Before starting, I would like to acknowledge the Cochrane Knowledge Translation Evaluation Support Project and the Center of Evidence-Based Healthcare at Stellenbosch University for contributing to the contents of this presentation. I thought, just as a way of introducing this topic, I could ask right at the start for us to have a bit of an interaction around those of you who have had some experience with implementing knowledge translation activities. Or if there are any people here who would like to share experiences who've evaluated any program of work before, not specifically just knowledge translation, or people who've had specific experience with KT evaluations. Is there anyone on the webinar today who would like to share an experience related to any of these 3 questions? If you'd like to share an example, please could you just indicate so in the chat box, and Amir, I think, would help with the ordering of people sharing a few examples. Okay, I assume that no one would like to share an example at this stage, but please feel free to do so at the end. I think it's useful to actually show how we do KT evaluation in practice, and so I think sharing examples will be something that will help share lessons that we've all learned. So the objectives of this webinar are twofold. Firstly, to understand why it is used to map out the aims and activities of our KT work. And we do so by using a framework or what we call a theory of change. And secondly, the objective of this webinar is how to plan, how to evaluate whether our KT activities and processes achieve the desired outcomes. So this is to measure whether we made a difference or influence a particular policy or practice. And so I'd like to start off with a definition of KT before we talk about developing a theory of change and an evaluation plan. Health decision makers, for example, patients, nurses, doctors, policymakers, often have access to different types of information and sources, which they can use to make decisions about practice or policy changes. So evidence produced by us as researchers or from research studies is only one type of information or source that health decision makers can draw on. So the definition that is widely known of KT is this one from the Canadian Institutes of Health Research, which defines KT as the exchange, synthesis, and effective communication of reliable and relevant research results. The focus is on promoting interaction among the producers, which can be researchers, and the users of research, which can be the health decision makers, removing the barriers to research use and tailoring information to different target audiences so that effective interventions are used more widely. So this is a bit of a mouthful. And so to simplify it, we can say that KT is about getting the right information to the right people in the right format, at the right time, at the right place, in the right way to influence health decision making. And so when you develop a KT strategy, we are ultimately systematically thinking about the aspects in blue. So we're thinking about information, people, format, time, place, and way. One aspect that is really important in KT are the people. This is what we usually call the end users of our research, or the stakeholders, or the KT audiences. And it doesn't matter which of these words you use, you can use them interchangeably, but ultimately it describes the people that we want to engage through our research. In KT, we always want to know who is interested in our research, who has influence over our research. So for example, who can actually promote our research and champion our research, or who has the potential to block our research or resist our research. We also want to know who do we want to engage with, who do we want to involve, consult, and empower through our research or our research findings. And so a KT strategy is the planning or preparatory phase, and it should be ideally developed when a research project is being conceptualized. So that from the start of our research, we already understand who our audiences are, what we desire to change in those audiences or in their decision making, and through which activities, processes, and outputs we can achieve those desired changes. So every KT strategy should be underpinned by a theory of change, which simply means that we want to be able to map out in a systematic way who our KT stakeholders are, and we want to show in the format of a diagram or in a table how our different KT activities, processes, and outputs work together to produce the desired outcomes in KT audiences. It is useful to develop a theory of change because it helps us map out what we are doing and why. In addition, it also helps us map out our KT activities, processes, and outputs. It can help us question whether the activities, processes, and outputs we are implementing will realistically lead to the outcomes that we want or that we desire to see. It can also help us identify which activities, process, measure, and to be able to see whether we're making a change, whether we're having the impact that we hope for. And so we use a knowledge translation evaluation plan to plan for measuring our desired change or the difference that we're making. Also want to say at this stage that a KT framework or a theory of change or an evaluation plan is simply a tool to help us think about what we're doing and how we will know whether we are achieving what we wanted. And so sometimes I think calling it a framework or a theory of change or an evaluation plan makes it sound really complicated. But it's just a way of helping us to systematically map out what we're doing and why we're doing that. I also want to say that there are lots of templates and tools available to help plan out what we want to do or how we want to measure it, not necessarily specific to KT. And some of those templates and tools are as simple as a table listing what we will do, when, how, and the impact that we want to see. The important thing is to think through or to determine what the clear link is between the KT activities, processes, and outputs, and how these will help us achieve our ultimate goals. We also want to have a way of tracking whether we are headed in the right direction, so whether we are likely to achieve our goals. I've summarized the steps for developing a KT theory of change. I specifically say a KT theory of change because there may be slight differences in these steps depending on what the theory of change is being used for. So just as a way of summary, the steps are about deciding on the purpose of the theory of change. So why are you actually developing a theory of change, and how will it help strengthen your KT work? Deciding on the vision and the desired changes that you want to see through a KT program of work that you're implementing. Deciding on who are your domains of change. What are your priorities in terms of your KT program? Deciding on the activities, processes and outputs that you want to be able to implement during your KT program, and also being able to clearly show the pathway of change to the desired outcomes. So I'm just going to elaborate on these steps a bit further. So the first step is about deciding on the purpose of the theory of change. And here we ask ourselves questions around whether we are wanting to develop the theory of change because we are designing or we are starting a new KT program, or whether it's because we are wanting to upscale or reprioritize an existing KT program, and also asking questions around who should be involved in developing the KT theory of change. So this is really finding out how will the KT theory of change help us with our KT program of work. The second step is about the KT audiences. In other words, it's about what are the desired changes that we want to see as a result of our KT program. Do we anticipate that the desired changes will take place over the short term, the medium term, or the long term? And also, if we look across our KT outcomes, what is our overall aim? So this is setting out exactly what we want to achieve with our KT program. The third step entails identifying the domains of change, and that is where it is that we can spark interest or where we can affect influence. And this is on people, namely our KT audiences. So we develop a KT program for internal or external audiences. So for example, we may develop a KT program where we want to make changes in fellow researchers and colleagues at our organization, who then lead to potential changes in our external audiences who are sitting outside of our organization. We also ask ourselves at this stage, when deciding on the domains of change, whether we are targeting individuals, for example, the Minister of Health, or if it is that we are targeting organizations, for example, a patient advocacy NGO. And we also ask whether we are looking at all types of KT audiences. So are we going to, is our KT program of work targeting, for example, patients, the consumers, the general public, health practitioners, healthcare managers, policymakers, other researchers, funders, or are we specifically looking at a subset of those KT audiences? And then another thing to decide on when developing our KT program is what our priorities are. So we ask ourselves questions like, with whom do we have the most or least influence? So when we develop our program, do we want to target people where we have the most influence on, or those where we have the least influence on? Which KT activities, processes, and outputs are feasible to implement? What are our timelines for implementing the KT program? What resources, for example, time, personnel, money, do we have to us to be able to implement the KT program? And then the fifth step in deciding is about deciding what KT activities, processes, outputs we want to implement. So there are different types of KT activities, processes, and outputs. So we will focus on, so we'll decide on whether we will be focusing on engaging KT audiences for conceptualizing our research project, or whether we will be focusing on dissemination products, for example, producing policy brief, infographics, newsletters. We also ask ourselves whether we'll be focusing on teaching KT audiences how to interpret our research findings, whether we'll be focusing on building bi-directional relationship with KT audiences. So we need to make decisions about the activities and the processes and the outcomes that we'll be implementing. Or to decide if it changes a P program, or if it is about building a new KT program in the future. And lastly, we also want to decide who will be responsible for for implementing the KT program. Is it going to be a researcher or a KT officer, or do we need to hire someone else? And then the last step in developing a KT theory of change is that we need to agree on what our underlying assumptions are about the changes that we desire to see. So how will those changes come about? In other words, what is the relationship between KT activities, processes, and outputs and our desired changes? And given that we have specific desired changes, are the priorities that we've set in the fourth step correct? Are the KT audiences that we are targeting the right ones? Do we have enough to show that it's changed the screen in terms of what you can see? It's a bit slow, apologies. Okay, there we go. So I've displayed here an example of a theory of change in the format of a table. And there are different ways in which we can display a theory of change. And theories of change don't need to be complicated models or diagrams. They should be easy to understand, and they should be accessible to all members of the team that is working on the KT program. In this particular theory of change, there are three categories, which are input, output, and outcome. And I'll explain these using example of a review that I conducted on the effectiveness of TB interventions for healthcare workers. So the inputs are the KT activities, the process, and the outputs are the results or the that come from conducting the review. So, for example, a manuscript itself, drafted to summarize the types and effectiveness of TB to healthcare workers. So what I've done is I've taken us through the theory of change from the inputs through to the outputs to the outcomes. And one tip or trick of testing whether your theory of change makes sense is to actually start at the back. So start with outcomes and taking us all the way through inputs. And there should be a logical flow and a relationship between those different components. So for example, Our long-term outcome here is to lower the rates of transmission of TB in healthcare settings between healthcare workers and TB patients. And so we will do so by raising awareness about different evidence that is available on interventions from actually for preventing TB transmission. That awareness raising that we do is enabled by us having conducted a systematic review, us having been able to summarize that information into a policy brief to share with policymakers, and also having that evidence available for use in guideline development. And having the systematic review, the policy brief, and the evidence for guidelines was all made possible because of the inputs which are personnel, secondary data, and also the resources, other resources that we needed to conduct the systematic review. The second theory of change example that I'd like to show you includes both internal and external outcomes. So here we are targeting change internally within our organization or amongst our team, not only external stakeholders. So this example is about a KT program of work that not only results in desired changes in external KT audiences like patients, health practitioners, and policymakers, but it is also in internal audiences like colleagues or fellow researchers within our organization. And this is a specific example about Cochrane South Africa's knowledge translation program, where the aim was for all Cochrane South Africa staff to conduct priority setting in order to identify research questions that are of interest to their KT audiences. So Cochrane South Africa aims to embed shared priority setting as an essential part of the research process. And as a result, a priority setting document, guidance document was developed that Cochrane South Africa staff can use. And we hope that this guidance document will lead to them having more knowledge, more confidence, and more motivation to run priority setting workshops with target audiences. And we hope that knowledge, confidence, and motivation will result in them actually running priority setting and building relationships with members of target audiences, so that target audiences are involved in priority setting at Cochrane South Africa, and ultimately target audiences have the relevant evidence, research evidence to inform their decision making. So once we have a theory of change table, we can make a theory of change figure or a diagram, and there are different ways in which we can display a theory of change visually. Sometimes this helps to just make the information more digestible than keeping it, for example, in the format of a table. So the theory of change example on the left-hand side includes information about the assumptions of the theory of change. It also presents some resulting actions, so intermediate outcomes. It includes some pictures or icons, and there's minimal text. Whereas the one on the right has a lot of text, seems more like copy and paste from the table. Each of the boxes have a different color and they represent a different component of the theory of change. And it also uses very formal theory of change language. So things like inputs, activities, outputs, short-term, medium, and long-term changes. So I'm just going to stop now and ask whether there are any questions or comments. And as Amir has mentioned, just to manage the questions and comments, if you could maybe type it into the chat box. Okay. So I see a question from Nazreen. Nazreen, would you like to unmute yourself and ask the question?
Hi, Dee. Thank you so much for your presentation. Sorry I joined slightly late. I was referring, yes, to the example one, and thank you for walking us through this. So I guess it looks similar to a log frame, but yet it's obviously different and unique based on the reflections that you've all had at the MRC. And I was just wanting some understanding and clarification on a couple of things. So the first question is, under your short-term outcomes, you mentioned that the main outcome is to raise awareness, but then you also list the activities under there. And I'm wondering whether there's a reason why activities would or would not have to be listed separately to achieve the outcome, or whether there's some really distinctive thinking about why it's important to have them embedded like this. That would be great. And then also how you see the outcomes feeding into each other. So the second question is on the longer term outcomes. You mentioned two, the lower rate of transmission, and you also talk about putting evidence-based guidelines into practice. So just thinking about how you distinguish those two would be great to understand. And lastly, you mentioned obviously that this is a dynamic process in some ways in terms of the nature of KT, but obviously it's really hard to always capture that cyclical and dynamic nature. And it seems in many ways easier to obviously depict steps like this. And I'm just wondering how you think or how you are kind of thinking about the implementation of something like this that obviously, as you said, wouldn't necessarily be linear, but if someone had to follow it, it appears linear. So just some guidance would be really great on that, Dee. Thank you.
Yeah, thanks, Nazreen. I think I'll start with the last question, just because I think that's one of the aspects of KT that is really important to emphasize. To say that KT itself as a whole, whether it's developing a KT strategy, implementing KT and evaluating KT, is actually a non-linear process. And when we present theories of change in a table like this, it sometimes makes it easier for us to be able to sort of list out the different aspects that fall under each component. So list out the inputs, the outputs, the outcomes, and as Nazreen also mentioned, the activities. But I think depicting it sometimes in a visual diagram, which is why I was saying that it might be useful to transfer this information into a visual diagram, actually may help us understand that nonlinear process. Even in terms of developing the theory of change, it might not be as simple as just going in the circle that I presented earlier. It might mean that you've, at the end, when you actually think about the pathway of change, that you end up going back to your activities because you actually realize that the activities you have proposed don't necessarily lead to the desired changes you want to see. So just keeping in mind that this is just a format where we present this to sort of neatly list out different aspects that we need to consider, but that actually the process happens in a linear manner. And some activities or some outcomes may happen or be observed at the same time. Then the two first questions are actually very similar. So again, I think here it's a typical example of trying to put too much in this table and not necessarily separating out clearly each of the components. So the first part around outcomes, the short-term outcomes and raising awareness, the activities listed under the outcomes, the short-term outcome should ideally be in a separate column, because those are activities that in the case of this theory of change, we theorize that these different activities could ultimately result to contribute to raising awareness. So they're not necessarily going to be done at the same time, or they may be actually listed out separately under a separate column even, as activities rather than actually being all lumped together in this table. So it was just an example to show that when we talk about awareness raising, the types of activities that we talk about may be discussing the policy brief or doing training with healthcare workers and so on. And then in terms of the long-term outcome, you are correct that that long-term outcome actually can be separated into two specific ones. And I think what is really interesting sometimes with the long-term outcomes is that we need to be able to separate out what our long-term outcomes are from what our vision is. So the ultimate vision might be that our systematic review evidence gets used in informing health decision making, but that actually the longer term outcome is that we want to actually be able to lower transmission rates in healthcare settings. So there are two parts of it which can be separated out into longer term outcomes or into a vision. And there's a lot of bits of information here that has actually been lumped together to just give a broad sort of example, but can definitely be separated out. I hope that that is clear, Nazreen. And are there any other questions? Amir, are there any other questions in the chat, or can we continue and address some of these at the end?
So there's one last one from Nazreen. I'm not sure if you addressed it now in your response.
Perhaps you'll, sorry, this is Nasreen, perhaps you're going to address it later. It's more about the evaluation of some of these processes and outcomes, but perhaps it's still coming. So I'm happy to hold my question, and I'm sure there are more.
Okay.
And then there's one from MS, which says KT is to be performed after systematic review. I'm not sure if that is a question or what your response would be.
So that's a really good question. I think that in the example that I've presented, so the first example here, it's presented in such a way where we are doing KT after the research has been conducted, and we are now trying to translate the research findings that came from that systematic review into policy and practice changes. But KT is a process, like I've said before, that should ideally take place right at the start of your research. In fact, ideally our research should be informed by the way we engage with health decision makers. So for example, at the beginning of our research, we may want to conduct a priority setting exercise to identify what are research questions that are relevant to our KT audiences. And that will then inform the conceptualization of our research project. And throughout the research stages, we would then consult KT audiences, we would involve them, we would empower them, we would engage them in different ways to ensure that not only is our research being taken up at the end when we've done it, but that it's actually relevant and that they know how to actually interpret it and use it when it gets to the stage where we have our research findings. So no, KT is not a process that only happens at the end when we have our research findings. It happens throughout our research. Okay, so I think I'm gonna continue for now, and then we can talk about any other ones at the end. Okay. A KT evaluation plan sets out how we will know whether we are making a difference or whether we are achieving the change that we hoped for. It can be a simple document or a table listing what we want to measure, how we will measure it, who will do it, when we will measure, how we will analyze, compile, and use the information that we gather from our KT evaluation, and also what resources we need in order to do KT evaluation. So just again to emphasize the difference between a KT strategy and a KT evaluation plan. So a KT strategy is about planning and implementing activities, processes, and outputs to achieve desired outcomes, while a KT plan is about measuring whether the planned or implemented KT activities, processes, and outputs actually led to the desired change. So in terms of our KT program, we can monitor the impact we are having and or evaluate the impact we are having. And so to monitor the impact of our KT program, we may need to keep a record of each individual stakeholder that we engage with, how we engage with them, through whom, when, using what resources, and whether they responded to us or not. So if we go back to the example about Cochrane South Africa conducting priority setting, once we have a theory of change, it may be useful to actually develop a monitoring table or a spreadsheet. And so, for example, in the monitoring table or spreadsheet, we can list our goal, which is a combination of the KT activity and the audience outcome. Which is to invite audience representatives to run priority setting processes with them and to identify their research needs. We can then decide on which medium or forum we will use to actually send out the invitation. So for example, are we going to invite them to the priority setting exercise via email, and also how are we going to carry out the priority setting? Is it, for example, by organizing a workshop? And then we also want to record who is the person that was the messenger, so who invited our target members from our target audience. Is this, for example, the responsibility of the PI on the project, or is it a KT officer? And we also want to be able to set deadlines to send out the invitation and the date of the workshop. And sometimes we may also want to keep a record of the resources that we use. So for example, the time spent drafting the email or the time spent developing the workshop materials. And then finally, we also use our monitoring table or spreadsheet to track whether the individuals we invited responded to having received our email or confirmed that they will be attending the workshop. And then in terms of being able to evaluate the impact of our KT work, we summarize what we want to achieve and how we're going to achieve it in the first two columns. And if you can see, the first two columns are really just a copy and paste from our theory of change. What we want to achieve is that our target audiences have relevant research evidence to inform their decision making. And how we will achieve that is by running priority setting workshops. But we also need to find out whether running priority setting workshops will result in target audiences having relevant research evidence. And so our evaluation question is really whether running priority setting exercises will result in target audiences having relevant research. So in the third column, we'll need to define what success looks like. So what does it look like when target audiences have relevant research evidence? Is it, for example, in this case, when more than 50% of target audiences say that they have evidence from Cochrane that is relevant? And how will we collect target audiences' perspectives about whether they find Cochrane evidence relevant or not? So in this example, we could send out a survey via email, and we can then we also need to make decisions about how often we will measure that impact. Are we going to send out the survey monthly or annually, and who will be responsible to develop and disseminate the survey, and then also analyze who will be responsible to analyze the survey results. So like I said before, answering one of the questions, KT, including KT evaluation is most useful when we think about it at the start. So when we are planning our KT activities, processes, and outputs, it can be done systematically, but it doesn't necessarily have to be complicated. We generally do evaluation in our everyday activities. We probably ask ourselves often, did that go well, or did I achieve what I hoped for? And that's exactly how we should be thinking about KT evaluation as well. It's about asking how we are progressing and what is going well or not so well in terms of reaching our desired outcomes. So as a way of finishing off and allowing some time for discussion, I just want to talk through a few tips for doing KT evaluation. Firstly, every time we plan a KT activity, we need to think about how we will know whether we are achieving what we want. So we need to build evaluation into the planning of what we are doing. Secondly, evaluation can be very quick and simple. So we could, for example, decide that once we put up an infographic, for example, on our website, we could decide to call a few people to ask them what they thought about this infographic. And we could also, for example, email a few people once a month after training that we've conducted to ask them whether they've learned anything new, how they've applied the knowledge that they've learned at their training session. And so the third part is just to say that we should move away from focusing on just monitoring the number of people who actually, for example, visit our website or attend our training, but also to ask people questions before and after the training and to see how their knowledge improved. Or we could ask people whether our evidence influenced their decision making. So not just tracking numbers and saying 50 people attended a training session, but knowing whether that training session was useful or relevant to them in some way or another. And then lastly, just as part of KT in general, we should plan to have activities where we can celebrate successes and also review our learnings. And this usually entails that iterative process that Masreen mentioned about going back to look at our KT strategy, checking that our theory of change still makes sense, and updating our evaluation according to new or future KT activities that we've implemented or plan to implement. Yeah, I've come to the end of my presentation. So at this stage, I would just like to take any questions.
Hi, B. So I see there are some questions in the chat. There's one by Michael,
yes,
which asks, must KT only be associated with change or just research utilization? I'm not sure if you covered that.
So that's actually a good point to ask. So I think this really relates to the type of outcomes that we can measure in KT. And when I mention and say desired change that we want to see in KT audiences, that really means our KT outcomes, which can relate to relevance, usefulness. I think you're talking about research utilization, usefulness of our research, involvement of our KT audiences, reach to our KT audiences, whether they can actually access our research findings. So it's different aspects of what we want to see that we are talking about, not just associated with a change in a particular policy or in a particular practice, but also in terms of our relationships, for example, with KT stakeholders. Or their physical access to actually our KT product or output. And then I see that Teresa has asked a question about, do we also try to use multiple data sources to measure progress, such as survey plus document review? Yeah, I think you can use multiple sources. Usually, from my experience, it hasn't been with all research projects that there's been sort of a dedicated KT budget or dedicated time to work on the KT aspects of our research. It's usually just been thought of as end of our research KT, where we have our research findings already and now we need to sort of disseminate them. But using multiple sources is ideal because then you can measure different aspects. So a survey might give you more straightforward yes, no type answers. So you could ask aspects about were you able to access our research from downloading it from our organizational website, yes or no. So that would be a useful thing. But then you might also conduct, for example, interviews with a few of the people who responded to the survey to ask them further questions about, did you trust our research evidence? Did you think it was relevant to you? How? Why wasn't it? Which aspects should we be improving? So it is ideal to use both qualitative and quantitative data collection methods to actually measure our desired change, or to measure progress, as you've termed it, Teresa. Yes, so you also mentioned the aspect of being able to go back and see in, for example, specific documents, whether stakeholder documents, which could be an easy example, could be so going back to see in a guideline if actually there was a citation of them using our evidence, and that would be one way of actually measuring whether your research evidence was used or not. Yeah, I don't think there are any more questions in the chat. I realized that I didn't put up my email address in the presentation, but I'm very happy to do that if it will be helpful for people to email me specific questions. I've also just listed a summary of how the theory of change ties together the KT strategy, the implementation of our KT, and also evaluation. So what we decide in terms of the pathway to the change that we want to see in our theory of change is something that ties in across our strategy all the way to what we evaluate. So in our strategy, we're often concerned with what change do we want to influence and with whom. In KT implementation, we think about how are we going to achieve the desired change. And for KT evaluation, we ask ourselves, have we achieved the desired change, and to what extent? And then I've also left resources. I've left a link to the presentation that I think Joe Anthony presented on this platform at the end of last year, which is a more introductory presentation on KT. and then also the different purposes for KT theories, and also a link to tools to evaluate KT. So there you'll have more specific guidance on interviews, surveys, and any other resources that you can use to evaluate KT. And then also examples of the different types of indicators of success. And Amir has attached a link to our YouTube channel, to the Cochrane South Africa YouTube channel, where you can find all these webinars, and this webinar has also been recorded. Yeah, thank you very much for attending the presentation this afternoon.
Thanks, Bea, for presenting such a wonderful presentation. I don't think there are any other questions coming through at the moment. So thank you to all participants for attending. We hope that you can join our next webinar, which will be on the 21st of July. It will be Eleanor Ochodo from the Center of Evidence-Based Healthcare, which is at Stellenbosch University. She'll be presenting a topic called, or the title will be Appraising Diagnostic Test Accuracy Studies, and that will be on the 21st of July. We'll probably be sending a link with the advert in the coming weeks. If there are any other questions, I don't see anything new coming through, but we'll share the PowerPoint presentation, and like I put in the chat earlier, there's also a YouTube channel which we have with all previous presentations. Thank you everyone for attending, and thank you again, Bea, once again for such a lovely presentation.
Thank you, Amir. Bye-bye, everyone.
Bye-bye.
Thanks, Bea. Well done.
Thank you. Bye. Thanks, Bea.